Hello students, today we will discuss about perioperative arrhythmias. The arrhythmias are common during surgery and after surgery and have numerous causes. Postoperative arrhythmias are most likely occurs in patients with structural heart disease. The initiating factor for arrhythmias after surgery is transient insult such as hypoxemia, cardiac ischemia, catecholamine excess or electrolyte abnormalities. The incidence of new onset of atrial fibrillation after cardiac surgery approaches up to 33%. Such arrhythmias are associated with worse outcome. Several major factors contribute to the development of perioperative arrhythmias. Number 1. General anesthetic. The volatile anesthetic agent such as halothane or enflurane produces arrhythmias, probably by re-entrant mechanism. Halothane also sensitizes the myocardium to endogenous and exogenous catecholamines. Drugs that block reuptake of norepinephrine, such as cocaine and ketamine, can facilitate the development of epinephrine-induced arrhythmias. Volatile anesthetic may have an antifibrillatory effect in response to acute coronary occlusion and reperfusion, at least in cocaine model. The sevoflurane may cause severe bradycardia and nodal rhythm when used in high concentration during induction in infants. Desflurane may prolong QTC within the first minute of anesthesia in patients with normal heart. This is about general anesthetic. Now we will see about local anesthetic. Regional anesthesia by central neuraxial blockade. The goal of spinal and epidural anesthesia may be associated with profound, transient pharmacological sympathectomy. This phenomenon may cause parasympathetic nervous system dominance. This will lead to mild to very severe bradyarrhythmias when the block extends to a very high thoracic levels. Inadvertent intravascular injection of large dose of local anesthetic may lead to systole, that is asystole, may lead to asystole and cardiac arrest, which are very difficult to treat. One proposed treatment is administration of 20% intralipid. Then we will see about abnormal arterial blood gases or electrolyte levels. Excessive hyperventilation, particularly in presence of low serum potassium levels, may precipitate severe cardiac arrhythmias. Alteration in blood gases or electrolytes may lead to arrhythmias by producing re-entrant mechanisms or altering the phase 4 depolarization of conduction fibers. The electrolyte disturbances associated with cardiopulmonary bypass can also result in intraoperative arrhythmias. Then fourth, endotracheal intubation. This maneuver may be the most common cause of arrhythmias during surgery and is frequently associated with hemodynamic disturbances by eliciting autonomic reflexes. Then fifth, autonomic reflexes. The vagal stimulation may produce sinus bradycardia and allow ventricular escape mechanism to occur. It may also produce AV block or even asystole. These reflexes may be related to traction on peritoneum or direct pressure on vagus nerve during carotid surgery, during jugular venous cannulation, stimulation of carotid sinus by palpation of the neck can lead to bradyarrhythmias. Specific reflexes such as oculocardiac reflex can also produce severe bradycardia and asystole. This is about autonomic reflexes. Then sixth, central nervous system stimulation and dysfunction of autonomic nervous system. Many electrocardiographic abnormalities can occur in patients with intracranial diseases, especially subarachnoid hemorrhage. The abnormalities are most commonly STT wave changes and may easily mimic myocardial ischemia and infarction. The mechanism of these arrhythmias appear to be related to change in autonomic nervous system tone. Now we will see pre-existing cardiac disease. This is probably the most common background for arrhythmias during general anesthesia and surgery. Patients with pre-existing tendency for atrial or ventricular arrhythmias are more likely to exhibit them during or after surgery in response to perioperative stress or secondary to acute withdrawal of oral antiarrhythmic medications, most commonly beta blockers. Now next will be central venous cannulation. So the insertion of catheters or wires into central circulation frequently leads to arrhythmias. Then we will see the surgical manipulations of cardiac structures. Arrhythmias are frequently observed during insertion of atrial sutures or placement of venous cannulas for cardiopulmonary bypass during cardiac surgery. They are usually self-limited and ceases at the end of manipulations. Then next, location of surgery. The dental surgery is often associated with arrhythmias because profound stimulation of sympathetic and parasympathetic nervous system. Then junctional rhythms are often seen and may be caused by stimulation of autonomic nervous system by fifth cranial nerve. Then the oculocardiac reflex leads to severe bradycardia in response to traction on rectus muscle of the orbit. This reflex, which is mediated by the trigeminal nerve as the afferent limb and vagus nerve as the efferent limb, is especially sensitive in neonates and children and common during strabismus operations. This is about the perioperative arrhythmias. Thank you.